released by the House GOP.
And no surprise here, Democrats don't like it, but here's something that may surprise you. A growing number of Republicans and conservative groups are also against this. Tommy Binion, the Director of Policy Outreach for the Heritage Foundation, joins us. Tommy, thanks so much for being here.
Good afternoon. Thanks for having me.
All right, so I did some checking around. I know your organization sort of blasted this plan. Tell me why you guys aren't necessarily thrilled with this.
Well, it's too close to the original Obamacare. I've speculated that if Democrats had proposed this bill in 2009 in the place of what became Obamacare, Republicans would have opposed this bill just as vociferously. It leaves in place a very large subsidy scheme for health insurance. It leaves in place, at least for 3 years, a massive expansion of Medicaid. And it fails to address what's driving up our cost of health insurance. Health insurance is going to be just as expensive as this bill passes. And that's the real problem with Obamacare, is that it's causing us to pay much higher premiums on health insurance.
It didn't seem like there were many specifics as to how you drive down those prices aside from eliminating the individual mandate, eliminating the employer mandate. It didn't seem like we were talking about, I know the president said, it sounded very much like if you like your plane, you can keep your plane. What President Obama said, President Trump said, you can keep your doctor. But I'm not seeing what safeguards are in there at this point.
Well, the way to drive down cost is to let the free market go to work. If 2 or 3 or 4 firms have to compete for your business, they're going to lower their prices and they're going to offer a better product. Under the regulatory scheme that Obamacare put in place, and this bill leaves in place, insurance companies aren't having to compete with your business. Many Americans are faced with only one choice of health insurer, and therefore that health insurer can charge whatever they want. The free market and competition is ultimately going to drive down the cost of any product, and that's what we're hoping to see comes out of this process. I don't think this bill is done. I think it's going to pass, but I think it's going to get a lot better before it passes, and when it does, it's going to unleash the free market on the health insurance industry.
Let me ask you, you guys mentioned that you don't believe this plan as it is right now will provide any meaningful relief for people who were adversely affected by Obamacare. Who is that group of people, and what sort of change would you like to see that would affect them?
Well, that's the group of people that are compelled by the government to purchase health insurance. And after Obamacare passed, the cost of health insurance went way up. So if you're not getting health insurance from your employer, if you have to purchase it yourself, and the cost have increased 100, 200, 300, or even 400% in some instances, there's no price relief for you in this bill, and you're the worst affected by Obamacare in the first place.
Tommy, there were a few components in the original health care bill that are sticking around. We're talking about children 26 and under can stay on their parents' health care. Nothing to talk about the pre-existing conditions, some other aspects like that. Would you say that had the Republicans taken that away, that maybe by not taking them away, they at least saw a few positive components in Obamacare?
Yeah, I think so. Insuring folks under 26 isn't very expensive at all. It just seems like the right thing to do. In terms of pre-existing conditions, I think that's an overwhelmingly popular issue, and Republicans could see the writing on the wall with that one. Sure, I think they saw a few positives with Obamacare.
Tommy, the president said this is the health care plan that he wants to put forward. But there's, obviously there's no way Paul Ryan is going to get everybody in line here to approve this. How likely or how long do you think this is going to take for everybody to work this out to be something that the majority of people like?
Well, the president said he likes this bill, but he said it was the opening gate for negotiation. We're going to have a couple of weeks, maybe 2 or 3 weeks in the House, and then could be 2 or 3 weeks in the Senate to fine-tune this bill. And at that point, after it's gone through a round of changes, we'll see if Paul Ryan can come up with the 218 votes. I would say that the hard deadline for this is the same as the spending deadline, April 28th. If we haven't repealed Obamacare by then, Republicans will be faced with a choice of whether or not to fund Obamacare, and we know how that went down in 2013 with the government shutdown.
Yeah,
all right, Tommy Binion of the Heritage Foundation, good to have you in tonight.
Thanks a lot.
All right, another key health care issue, of course, the cost of prescription drugs